This video is continuation of shoulder joint. Here, we are going to study about sternoclavicular joint, that is collab of sternum and clavicle. So it is a saddle shape of joint. That means it is a highly flexible type of synovial joint where one bone is concave and the other is convex. It contains three ligaments, that is, interclavicular ligament, that is present on the roof, then we have costoclavicular ligament, that is between the rib and the clavicle, and anterior sternoclavicular ligament. Movement around the planes. Here in frontal plane we have protraction and retraction of the shoulder. In sagittal plane we have elevation of the arm. Then we also have articular cartilage as a shock absorber in between the sternum and clavicle. Now next we have rotation of the SC joint. That is, when does it work? It rotates during shrugging of shoulder. Elevation of the arm and during the activity like swimming. Close packed position. What does that mean? When is the joint stable, in which position? The close packed position of the SC joint is elevation of the arm. Next we have Coracoclavicular joint and Acromioclavicular joint. AC joint is formed by acromion process and clavicle, whereas CC joint is formed by coracoid process and clavicle. What are the functions of this joint? In shoulder joint, first, it acts as a shock absorber. It also helps in stabilizing the joint during full range of motion, and transmits forces from upper limb to sternum just like clavicle. Next weekday are the movements of this joints. It helps in raising the arm also during internal and external rotation of the arm, which allows the shoulder blade, that is scapula, to stay with the curved rib cage. What must be the close packed position of these joints? It's abduction of the arm.
Today we are going to study about scapulothoracic joint. Scapulothoracic joint is the collab of anterior part of scapula and posterior part of thorax region. The function of scapulothoracic joint are: it helps in contraction and stabilization shoulder joint. Also helps with facilitating movement of upper limb, that means it helps with the moment of shoulder joint. Muscles. What are the muscles around the scapulothoracic joint? The muscles of scapulothoracic joint are levator scapulae, trapezius, and rhomboids. This muscles helps with the movement of scapulothoracic joint. Next, what are the movements of scapulothoracic joint? Elevation of humerus in all planes. Here, this joint helps with the elevation of humerus. In flexion, extension, elevation, depression. When the arm is abducted, this joint is more stable, that means the close pack position is abduction. During the elevation of the arm, at 30 degree the scapula, it rotates 1 degree for every 2 degree of motion. That means whenever there is movement of humerus during the range of motion, the scapula works to support as 2:1. So this whole movement of scapula is known as scapulohumeral rhythm. And the scapula is more stable when it is loaded, as the muscles around the shoulder joint contact to stabilize the shoulder.
Now let's see the load on shoulders. First we have to know, what is torque? And what is moment arm? Torque, the rotational force produced by the muscles around a joint by external load like weights. And moment arm is the shortest, perpendicular distance between a joint axis of rotation and the line of force acting on a body. Now let's understand this in easy way and simple words. When you try to push the door near the handle, you need less strength. You can even close it with a finger, but if you try to close the door near the hinge, you need more strength. Now, as you can see in the picture, a long arm and short arm. The long arm needs more strength, and there is compress force on the glenohumeral joint. The workers who work in long arm position may get wear and tear or tendinitis, as it is not safe. In short arm there is decrease in momentum, therefore less torque. As in long arm there is increased moment arm and increased torque, increased muscle work, due to which there is increase in force. Next, let's know what are the common shoulder injuries. First we have dislocation of the shoulder joint. Rotator cuff injury. Also subscapular neuropathy, that is nerve palsy. Mainly caused in athletes. This was the complete shoulder joint biomechanics. This video is made according to the book Biomechanics Made Easy by Sheraz S. Malik and Shabazz S. Malik. Comment what should be the next video.